Welcome, everyone, to our first Dr. NAACLS of January. I had to double check my math on that because it already feels like 2025 has been going on quite a bit. So let's go get started with the mission and the vision and values. NAACLS is committed to being the premier accreditation agency for ensuring advancement in education and clinical laboratory sciences and related healthcare disciplines provided by domestic and international programs. Our vision is that medical laboratories preferentially seek graduates of NAACLS programs to ensure quality, value, innovation, safety, and safety for healthcare consumers. And our values are quality, education, innovation, collaboration, peer review, and global accreditation. So we like to timestamp these presentations because we do make them available on YouTube and the NAACLS news. So since our compliance requirements can change up to, and usually at least twice a year, would be a better way to put it, after our board meetings in April and September, definitely. We like to just mention when this was recorded. If we do, during the Q&A portion of this, start talking about standard interpretation, and you're watching this at a later time, please double check to make sure you have the most up-to-date documents on our website, and you can always touch base with NAACLS staff to make sure you have the most recent documents with the most recent requirements. Today we're talking about innovations. We have two co-hosts. We do this every January. It's kind of our new tradition with Dr. NAACLS, is that we take the innovation answers from the annual survey, and we kind of go through those to pick out items of interest. And every year we have our board president or president-elect join us, so that's Karen Brown. And our CEO, Marisa James, is joining us as well. So let's talk about innovation. Innovation is really at the core of what we do, and it's why the board of directors has such a fierce commitment to making sure the standards are not prescriptive, because that allows for programs to not only sustain but grow. So they try a very hard job to make sure that that space for that growth is supported and really supported by the board and the full organization. Now, when we mention innovation, what we mean specifically is any technique, delivery method, partnership, etc., not practiced or attempted previously. So these changes or these innovations can be very, very subtle. It doesn't mean something to be that is a significant or a radical change to the foundation of your program. It's just something, it could be something that large or that significant, or it may be just something small that you tried for the first time, and then are hopefully monitoring what those changes, how those changes affected your program. So speaking of that, a lot of, and we notice this a lot in the presentation, which is great, a lot of innovations that programs participated in were always somehow tied to standard 2. They were either mentioned in the context of they were driven by feedback, which is part of standard 2, or there was references to assessment after those changes were made, which is great because that's exactly what we want to see in standard 2. Standard 2 is all about assessment and continuous quality improvement. And it's a good time to put in a plug that while we'll probably talk about standard 2 a little bit, if in order not to get bogged down by standard 2 questions, because we know there's a lot of feedback and maybe a little anxiety about standard 2, we're having a whole Dr. NAACLS dedicated to standard 2 next month. So we just released that information on the NAACLS news. So that sign up is available, and it's on February 20th at 1 p.m. Central. Karen and or Marisa, do you have any feedback on innovations in general or its ties to standard 2?
Well, I'll just say that standard 2, as Mark mentioned, is really a very important standard, and the main thing with that is to close the loop. When you do have some kind of modification or something new that you've tried, document it and track it and see if it's going to be effective for your program over time. So just want to emphasize again the importance of closing that loop with standard 2.
Yeah, and closing the loop also means that maybe the change wasn't good. Maybe you have to abandon that new change. And so it doesn't always mean that you were successful. You just tried something, it didn't work. And how do you close that loop? You probably ask for feedback yet again.
All right, moving on then. So one more piece of housekeeping before, hopefully, if my memory serves me correct, we get into the bulk of this year's um, survey, is that we continue to see a lot of great and exciting innovations from programs that we may have mentioned before. Like I said, this is, I think, the third or fourth year we've done this, where we've taken answers from that innovation question on the survey and focused on the Dr. NAACLS. So some of the great things that are happening that we've seen consistently, like adding feedbacks or acquiring grants, adding affiliates, acquiring grants, finding new ways to gather feedback. We kind of shifted our focus. So we didn't just talk about the same thing and slightly different nuances every year. So if you kind of haven't gone back and seen some of those previous Dr. NAACLS, it's every January. It's on the NAACLS News. It's on our YouTube page. If you dig a little bit, you can just check it out, have it on in the background while you're doing some work, or just if you need to find maybe some different inspiration on ideas we're not talking about explicitly today. Okay, so we mentioned this a little bit before. So this, Marisa, this may be if you have anything to expand on this, but as I mentioned, one thing that really stood out was the references to standard two when it came to the innovations. So for standard two, you don't necessarily have to try something completely different. It can, again, those subtle changes don't have to be innovative by how we define it, but it was gratifying to see how much of it was either referencing the changes based on feedback or mentioning how it was based on things assessed from other changes. So Marisa, did you have anything else that you want to point out or kind of expand upon when it comes to the relationship between standard two and what we saw for the survey responses?
Well, really, I just wanted to highlight that standard 2C is which is part of our core standards, it is required that you have findings from your graduates as well as employers. And that is where you're going to leverage a lot of resource out, like leveraging how you can obtain resources is by asking people that have been through your program, people who are working in your program, people who are hiring people in your program. And so really just having that mindset of receiving a lot of feedback, that's the biggest, I mean, that's what the bread and butter of this entire presentation is people decide, asked others where and how they can help your program. So that was the main thing I wanted to share.
Karen, did you have anything to add to that?
Well, and then I just want to add to emphasize again, document, document
Mhm.
everything and keep track of it. Just so important.
Okay, so we saw a lot of innovations that were really targeted at very specific challenges that are faced on some of our disciplines that may be more specialized and have smaller numbers, things like phlebotomy, Path A, HT, HTL. So while there was a lot of creativity and really fascinating work done across the board, we also know that sometimes these other disciplines can sometimes get lost in the shovel of those with larger numbers like MLS and MLT. So we certainly wanted to um, specifically mention the creativity shown by all disciplines, but those who have specific challenges like HT, HTL, Path A, phlebotomy, Cyto, and MLA. Marisa?
Yeah, so when we pull this information from our annual survey, it comes into a Word document with over 100 pages. And so Mark and I do our own review over the whole entire document, and then we try to pick out some themes. And Karen also really likes to see the whole entire document because it is so much fun It's one of my favorite projects of the year to look at this, because I love seeing how program directors or program officials are just being creative and trying to think of new ways to meet the needs of their faculty or of their students and their programs. I love it. And so it's really fun to see in how people are, their real modifications to their programs. And you can also tell how excited and proud they are as well through many of the comments that we received. It's fun. I don't know. You can't help but be inspired by looking at all of it.
Well, exactly. And at first you think it's just written words, but as you're reading through it, you do feel the excitement and the pride that programs have in what they're trying. And many of the innovations that were shared were just paragraphs worth of, just so much that programs were doing. And, not every it's not expected for that, but you just do feel so, excitement looking at this and feel from the programs how they are proud in what they're trying. And yeah, you can pick that up just from reading it. It's pretty amazing.
So we want to start with advisory boards. One consistent theme from this year's survey was really the amount of creativity and work going into utilizing a program's advisory board beyond the requirements in Standard 7. And one thing that we want to point out was diversifying perspectives. So really expanding beyond what may be a conventional roster on the site visit, looking to add representation and legal representation from legal departments and HR, hospital administration. There was even some notes about how some of these things didn't work. And as Marisa said before, that's okay. But it's just the idea that people were thinking outside the box when it came to advisory committees and finding ways for different people to give different kind of feedback. Karen, did you have anything you want to add about specifically this expanding the perspectives on an advisory committee?
Well, I think that it is really innovative to look beyond our own. We are so as laboratorians in particular, very proud of what we do, and sometimes and as educators, you just think about what you're trying to accomplish on a smaller scale, but thinking outside the box a little bit, and who else might be able to bring some different perspectives to your program. So even though this one program tried to involve legal and hospital administration and HR, and it didn't really work, that doesn't mean it wasn't something good to try, and it doesn't mean that in a different part of the country, in a different program type, that it might not, it might very well work. And so I encourage all our program directors and faculty, if you have ideas, go ahead and give them a shot. And yeah, it may work in your area, even if it didn't work somewhere else. So
another thing we saw was programs using their advisory committee's feedback to create change within the program. One program used feedback from the advisory committee to develop an integrity lab. Another heard, and I believe this was a phlebotomy program, of how the program, they didn't think was long enough to prepare practitioners adequately. So that feedback helped the program advocate to their higher administration to lengthen the program. And also there was some ideas that came from advisory committee to develop pathways to get participation from students in high school to really get that next generation people of practitioners into the pipeline when it comes to the practitioner. So Marisa, did you have anything you wanted to point out specifically about leveraging this feedback to create change?
Yeah, so you kind of alluded to it a little bit, but we did have, I believe it was a phlebotomy program, who, because of their workforce shortage, they decided that they needed to shorten their program for a little bit, by like 3 weeks, I think, out of a 15-week rotation, I think, or 15-week program. And they did it for a couple of years, and then their advisory committee, as well, which included, some employers and, people from the community. And they had indicated, can we go back to 15 weeks? Because we really need to reinforce. It wasn't that they weren't becoming competent, but they really wanted to take them, get them a little bit more experience getting into the, as they got into the real world. And so that again is why you close the loop, is because when you ask that second time, or when you evaluate that second time, did this work? Did this not work? You just you can really decide if you need to make an adjustment or not. Sometimes that closing the loop is making 0 adjustments, but then also going back to some of your previous decisions, even from a few years ago, and see if they are still working. Further, I just want to, highlight how that program, their flexibility in being able to shorten their program by 3 weeks really helped them during a difficult time. And that's why the NAACLS standards do give you that flexibility, is because sometimes you're going to go through some rough periods. Maybe that was COVID for your program, and you need to make adjustments on the fly. And if you figure out ways to compensate and make sure your students still meet those competencies even with these adjustments, that just helps you get through some of those issues. Whereas if we had these specific, hour requirement or something like that, it can put some programs into a difficult spot.
Karen, was there anything additionally that kind of stood out to you when it came to using the advisory committee feedback for advocacy reasons?
Yeah, I wanted to mention a little bit about the development of the specimen integrity lab that a program started. And this lab, or this program, simulates real world scenarios that cover, with case studies that cover pre-analytical, analytical, and post-analytical errors, and as a way to strengthen and enhance that aspect of their curriculum. And so that was one particular innovation that I wanted to point out. And I also wanted to mention about pathways to participation from students in high school. And this was supported by advisory committee. The idea of trying to involve, and sometimes it's a challenge because in particular in a program like phlebotomy, where you need to have your students at least 18 years of age, this program was able to work with their local high school to start offering some of their phlebotomy courses at the high school level to some of the students as young as 16. So that was a way. So, looking for ways to try to work within their systems and within, the constraints that they might have, but yet moving forward with some very innovative ideas. And then just that last little sentence, I thought this was really a novel way to involve the advisory committee, was to have current students actually present some of their laboratory management projects or capstone projects to the advisory committee. And so I thought that was something that was definitely worth mentioning. And I would have liked to know how that really turned out. But there again, the program needs to document that, close that loop.
Okay, another trend we saw was really pushing the boundaries of partnerships, bringing or collaborations with other either departments within the institution or even outside of the institution. Within the institution, we saw a lot of partnerships with registered nurses, specifically some in the context of simulation. We saw some collaborations with radiological technologists and as well as with surgical tech departments. So Marisa, what kind of stood out to you about some of these collaborations and partnerships?
Well, I would imagine that a lot of these partnerships came from the new standard. We do have a new, in standard 8A, we do have a new interprofessional collaboration requirement. And, and so I would imagine came from, but then also I bet a lot of our program officials have just realized the value of collaborating with other professionals in healthcare. It's better for patient outcomes, and it's good for students to see that there's a lot of people that take care of patients, and that just to see the different, irons that they, I guess plates that they're trying to balance as well. And so I was just very happy to see a lot of different collaborations with these, nurses. It makes a lot of sense to collaborate with nurses, but then radiology and surgery, that's really cool. I love that.
Karen, did the partnerships that we see here within the institution stand out to you in any way?
Yes, it did. And we talked earlier about trying to, some programs were trying to enhance their advisory committee membership with HR representatives, legal representatives. Well, one program reported trying with one-on-ones with their director of student affairs to meet monthly and really thinking about the students and trying to help these students with financial obstacles that they might have. And we'll talk about a little bit later about the need for students to have financial support. But I thought this was a different way of approaching this area and the concern by the program to really help their students on a financial level. So this was a different type of partnership that I know I hadn't thought about exploring. So I think that was very innovative.
Beyond those partners that programs may find within their institution, there were some examples of going beyond those maybe self-made restrictions to partnerships within the community. A lot of concepts of ambassadorships, of asking students to represent the lab. There was also something interesting about partnering with other programs, accredited programs, to help direct applicants and receive support for clinical rotation placements, and then also varieties of what to do with alumni. So this time starting with you, Karen, were there any of these kind of community partnerships and beyond the barriers of or borders of an institution that really struck you in a specific way?
Yes, initiating the ambassadorships. This was they called it junior laboratory ambassadors, and it was a partnership with local vocational schools to specifically target youth programs and especially underserved students with underserved backgrounds. And so I thought this was a unique way this program was trying to help in the community, but also looking to maybe perhaps enhance enrollment in their programs. And then I think the partnerships formed with programs, developing a network with other colleges and institutions in their area is really good too. And particularly when you look at coordinating clinical rotation placements, because in many areas, and I know we see this in Utah, where I am, that we have a limited number of clinical rotation sites, but we have programs that are all trying to use these same sites. And so having a network with the programs and institutions within your area is one way to look at approaching how you can coordinate clinical rotation sites so that everybody can have a win-win situation, because we know how difficult it is to obtain and secure clinical rotation sites. Then the Alumni Hall of Fame, I thought, was a great idea too, because this was, again, trying to build a network with individuals that support the program, support students, and included recent graduates of the programs. And there again, just trying to expand that network in any way possible to elevate, I think, the program within that area.
So one program kind of combined both partnerships within an institution and also within the community by creating a multi-county-wide active shooter drill, which involved interactions with law enforcement agencies, local hospitals, EMT, EMS, fire science, criminal justice, nursing, cosmetology. So kind of an overwhelming amount of participation and collaboration. So Marissa, many things kind of stood out to all three of us when we were reviewing this and just the comprehension of it. So what struck you initially?
Well, this also would apply in your IPE, IPE, your new IPE standard. But these multi-county-wide type of exercises are really, really good for students to experience. And the fact that 100 students across all these disciplines were working together is incredibly important for something like an active shooter drill. But then also, anytime you're interacting with other professions, it's raising public awareness of the laboratory. And I think that's important. I think it's important for folks to know who is taking care of their laboratory results and who is, behind the scenes that is, that cares about patients. And so while you might not think that fire science and criminal justice, like maybe you're not going to have a whole lot of interaction, well, you very well could in an active shooter drill, but then also you never know what, if that person has a child that would be interested in lab. And there's just, I do like all of this partnership, because the more people who understand the individuals who are behind the scenes working to take care of you in a healthcare setting, I think the more informed the public is and should be.
And I agree with that absolutely. Public awareness for our profession is so important, and we all know that we're not as visible as a lot of professions. And I think during the COVID era in particular, we did gain a little bit more of from the public. I think we became a little more visible because of all of the emphasis on laboratory testing and so forth during the height of the COVID pandemic. But it's still, we need to keep that momentum, if you will, and keep have activities like this that do keep us in front of the public eye. So
We also saw a lot of innovations when it came to creating more investment either within their program, or program directors have taking the limited resources they had and choosing where to invest that to pay off in the future. So let's start with tech, which I think a lot of programs do to a certain extent, of trying to, in order to keep up with the demand, not only laboratory, but educators, is try to find what ways tech can compensate for that demand. We saw 3D printing models to increase simulation opportunities, acquiring software specifically for real-time student tracking and feedback, and also setting up an LIS for a student lab. Marissa, what stood out to you in the answers we got to the utilizing tech for investment?
Yeah, well, really what I was thinking on these next couple of slides is just how program officials were able to secure resources that were probably pretty expensive. And so it was pretty interesting to see what individuals acquired basically for their programs. And so, I look at a lot of these things and I'm thinking, okay, how did you manage to secure these resources? And, we've got right now on the NAACLS News, we've got a series of advocacy articles that we're sending to programs. And I encourage you to, head over to the NAACLS News if you haven't already, just to start to secure resources. And, on this, unfortunately, in the information that we received from the surveys, we weren't able to see how people pulled this off, how they were able to get approval. But if you are attending CLEC virtually or online, I highly encourage you to submit a CLEC proposal or a poster presentation or something. How did you communicate with your higher administration to obtain a 3D printer, to obtain this LIS? Like, those types of information is really beneficial to share with your educators. And I've just been kind of tracking the number of participants we have today. And so I want to say thank you for joining us, because we have 60 individuals that are joining us. And I hope that you are learning some new things that, that you can try. And then also, our community coming up with, going to be together at CLEC here in a few months. Talk to each other about how you were able to leverage any information, any feedback from, or advisory board feedback to obtain some of these resources, because some of this is really impressive.
It certainly is. And that's such a good point, Marissa, to emphasize that the need for everybody to find out how to approach your administration for some of the resources that really can enhance your program. And I think in our past, I only done one other NAACLS presentation on innovation, but I know last year we didn't see 3D printing. We didn't see so much of this. So I think this is going to be the trend with our programs to want to bring in more of this technology. And so knowing how to get the resources to approach your administration to support this is going to be very important, because I think this is where we're heading. And it's really important to be able to get that funding to do so. So these were really great innovations to see, but yeah, they still need to be funded. So
beyond investment in technology, there's also investment in faculty to develop faculty. Karen, were there any practices of the faculty development that you want to comment on?
well, there again, it takes some resources to support your faculty, but programs are doing that, and they're recognizing the need to have faculty with particular skills that maybe they don't come in with when they're hired. It's a lot of soft skills, maybe in particular. And one program having their faculty complete the master online teaching course, and it culminates in a certificate for those faculty that complete this. And so that, I think, is a way of not only boosting, the program itself indirectly through the faculty, but giving the faculty something too, and encouraging them to continue doing what they're doing. So I think that was one thing I wanted to mention. And then the instructor day was really, I thought that, and this kind of cabbages on a little bit to what we've talked about already with partnerships, but it's a partnership with faculty in different programs. And so the faculty would come together and they would get to know faculty from other programs in their in their area. But I could see that even going beyond, which all the virtual capabilities we have now. But it's a way to share best practices. And Marissa's mentioned CLEC and how important CLEC is to our community of educators. But that's one time a year. This is something that can go on multiple times a year. And I encourage people that do attend CLEC to keep contact with those individuals that you meet there, because having a network in somewhere to share best practices or to ask questions, and you're not sure where to go or how to find out something, then you have this network. So I think it goes beyond, there's a long list that you can garner from something like this, I think.
Mark, I was going to add also that a part-time faculty member is a place to start. So I know sometimes programs, they need more faculty and they ask for one or two more faculty, and or maybe they ask for one and they don't get it. Then maybe your compromise is, can we at least have a part-time faculty member? So starting somewhere and then being able to, this individual, I'm excited to hear how this part-time person helps for the future, because then once you get that, a part-timer, you might be able to convert that to a full-time as you prove and showcase, okay, here's what this individual was able to do. Here's how many people they were able to bring in. This is how much our enrollment increased because of this person. Like, sometimes you just have to start real small, and then you can kind of build on that.
Okay. There was a lot of innovation that we saw from programs that was really trying to address access when it came to providing compensation for students that may not have the resources to kind of put everything on hold just to attend classes. So Marissa, did you kind of want to start with this one?
Mm-hmm. Yeah, well, I wanted to just make sure that we don't have a standard that says you can't pay students. We have a couple of stipulations in Standard 5 F and G that basically say your students cannot replace staff, and the employment has to be non-compulsory. And so, you can have stipends, you can pay students, they just can't replace your staff, and that is for their protection, so that they, are not forced to work, are not basically, so they're still seen as a student. And so I really have been happy to see um, different organizations able to either, pay students in the form of stipends or allow students to work and also attend their program part-time or on evenings or weekends or whatever the case may be. And or developing some sort of a this workforce development of their current employees that can help them, rise the ladder, so to speak. And, education's expensive. And so if there's any way that, programs can help students afford to, there's jobs out there for them. So we just have to try and help them get to that point. So I was really happy to see a lot of that.
Yeah, and I think the reality for today's student is they have to work. Most students do have to work. And for programs to really try to find ways, and we talked about that a little bit earlier, trying to find ways to support them and help them so that they can be successful in the program, but still, live and bring in the income. And as Marissa said, it is expensive. And one program cited and partnering with an industry where and this happened to be a phlebotomy program, where new employees receive training while completing the requirements for the program. And then the partner covers the cost of the program with the expectation that the students, will stay and work there at that institution. But, well, how do you secure an industry partner? Well, ask, and they may say no, but this program approached and was able to work out a partnership. So, so this is just there again, another way of emphasizing that sometimes you don't know if things are going to work or not, but you just try it.
Mm-hmm.
And there's more than one mention of program directors talking about specifically trying to utilize their personal strengths in order to make some headway into some of the challenges they have, and their innovations were really based on their personal strengths and trying to utilize their strength. And there was also a lot of program directors that spoke about getting out of their comfort zone and trying to try new things and develop themselves as a program director, kind of under this umbrella of innovation. So Karen, it's your turn. Were there any specific items about either somebody utilizing their own personal strengths or people pushing their own internal boundaries that you wanted to comment on?
Well, a couple of things that I think about. There was one director that mentioned using his passion and enthusiasm, as a recruiting tool or mechanism for the program. But the other thing is, just as I read some of these comments from program directors about what they're trying to do, as you say, Mark, to get out of the box. And you could just feel their pride and their enthusiasm and passion as they're trying these things. And so I don't know, there again, even though I was reading written words, I could just still feel how much they were really trying to promote their program. That came out a lot. Program directors really trying to get their program out there in the community. So people would know, because we all know for most of our programs that are accredited by NAACLS, we're not big ticket programs. I mean, we don't have lots and lots of students like some allied health programs. I mean, there are, programs that have sizable amounts, but by and far we're not, really, really huge numbers. And so we do need to maybe work a little bit harder in that area, but our programs and our program directors are.
So that kind of wraps up the major items we saw. Again, I would encourage you to check out some of the older Dr. NAACLS January innovation presentations, because there was a lot of items that we saw conceptually, things that were very, very similar, which were great, but we wanted to kind of take the opportunity to focus on maybe some things we hadn't seen before or hadn't had the opportunity to really speak to. We are going to open up to Q&A, which can kind of be about anything, something you've heard here, or some standard interpretation questions. Before we get to that, just a reminder that we do have resources outside of this Q&A always available for you, specifically NAACLS staff. This is the best place to start. Predominantly, our focus is on policy and procedure, but for some of the more commonly asked questions that we hear discussed a lot during the review committee meetings, or that we see on self-study reviews or site visit reports, we can kind of tell you what we've seen in the past. For more specific standard interpretation questions, the best people to contact are discipline lead persons. Discipline lead persons, or DLPs, are sitting review committee members. They're content experts in the area assigned. So you'll see here that each of our DLP has a specific content expertise. Their contact information is on our website under the program directors page. If you scroll down about halfway, you will see kind of a little table that's separated by discipline, and each discipline has its appropriate discipline lead person and NAACLS staff contact person. And a few reminders as we open up to questions. We have a lot going on right now. You've probably seen the NAACLS news flooded. Everybody's still probably getting their feet under them after the holiday break. So just as kind of a general reminder, we extended the nominations for review committees and board members until April 1st. This is one of the more unique years where there are positions on the board that are open for public nomination. Our 2-year member and our public member. The specifics on those details are on the NAACLS news. If you are subscribed to the NAACLS news or on our LinkedIn page, you'll notice that we've had an advocacy series that we are starting to roll out, and we'll kind of go through, collect, and culminate into Dr. NAACLS in March. It's really focused on program advocacy, hopefully acquiring more resources. We're starting from a very general kind of 10,000-foot view, and as we proceed through this session, this content will get more specific and hopefully give some practical advice. Marisa and Robert will also be presenting an advocacy-related breakout session at CLEC. Speaking of CLEC, we are doing our workshop, which precedes CLEC immediately in March. The deadline for the discount rate is February 6th. Full disclosure, I don't remember the ultimate cutoff date. That is on our website, and all NAACLS staff has that in the signatures of our emails, but I, at least right now, want to get that notation of those who wanted the discounted rate. The NAACLS workshop is not included in your CLEC registration. So if you're going to CLEC and made that registration, do not assume that also includes the NAACLS workshop. Our partners at ASCLS have done a really good job over the past 5 years kind of clarifying that, but we want to make sure everybody's clear about you need an additional registration for the NAACLS workshop. We will have a booth at CLEC. When we get closer on the NAACLS news, we'll kind of release when our program service members are assigned to the booth. So if you have specific questions, or if you just want to meet the person on the other end of the phone that you talk to, we encourage you to stop by the NAACLS booth and say hi. And our next Dr. NAACLS is February 20th at 1 p.m. Central, as we said, focusing on Standard 2. So with all of that, we are open for Q&A. You can either raise your hand and I can give you permission to talk, or you can enter it in the little Q&A chat. Okay. First question, I have hired a new adjunct who is a retired MLT. She does not have any recent professional development to attach to her faculty data sheet because she retired in 2021. She is working on some now. Is this okay? I can kind of start with this, and then Marisa, Karen, if you want to jump in, obviously you're more than welcome to. This is kind of an example of what staff has heard through a lot of review committee meetings. Faculty development is a common question or that pops up on site visits and self-studies. So the first item is this adjunct considered part of your core faculty? So if you look at the standards and standards compliance guide, we only gather information on who you determine as your core faculty, and we let you define who your faculty is. So for those members, and I'm speaking to this without the compliance guide in front of me, so if the compliance guide has a little other variations, please contact staff or your DLP. But if you, for those people you do consider your faculty, you will need to fill out a faculty fact sheet. And then I believe you need to include the professional development they have done. Now, faculty is not like the program director where they have a prescribed amount of hours that they need to meet. Program directors have a set amount of hours that's in the standards. We do not set a specific amount of hours for faculty. So based on those two variables of letting you define who your faculty is, and also the non-prescriptive nature of the amount of hours, that's about as close as I can answer it. Marisa and Karen, didn't know if you had anything to expand on.
Well, I'll just add that if this person is identified to be someone who teaches your core courses, part of what the would be evaluated through your self-study and on-site review next time is the person qualified to be doing what they're doing. And so just want to see that the professional development has some component that would reinforce that. Doesn't have to certainly be all of it. And it's just an ongoing accumulation of if you will, of professional development activities. But yeah, there's no prescribed set hours.
I will say, and then Daniel, I'll get to your comment. In general, the review committees and the board pays a lot of attention to what is done versus what is planned to be done. The plan to be done, unless things are completed, are generally, there's a little bit of nuance there depending on the standards, but for the most part, it is what has been completed when they're being, because the role of an accreditor is to quality assure by viewing what's been completed. So plans are great, but sometimes those might not always demonstrate compliance with the standards. So Danielle, I have allowed you to talk, but you'll have to unmute in order to speak. That may be Daniel too. All right, while we're waiting for him, does anybody else have any other questions they wanted to drop in the chat? That was the only question we had. Okay, looks like we have one more question. Pat, go ahead.
The point that you were just discussing about who has to fill out the faculty sheets, etc. I don't know how to make that more clear, because sometimes programs, they have everybody that it has anything to do with the program in the hospitals, everybody that teaches at the bench, etc., fill out those forms. And I don't know how to make it more clear that the people that you just specified are really the only ones that need to do that.
I mean, you're right, Pat. I have heard those, so I can confirm through seeing self-studies and just through conversation, through site visits, that's happens. And I know you've been on a lot of self-studies and site visits in addition to your terms on the board and board liaison. We have tried developing a glossary for for NAACLS programs. That's in the back of the standards compliance guide. So I would, as it's something new, we'll see how successful it is. But in general, if there's some terminology you're unclear about when it comes to kind of NAACLS speak, I would start with that glossary in the back of the standards compliance guide. I'm guessing that will kind of be expanded upon and refined as we kind of move through and give you used to having this glossary, but that's a good place to start. And I'm pretty sure that we define faculty there.
We do, I just checked. We do define major didactic faculty in the glossary. Do you want me to read it? I can read it. The core group of faculty members or instructors the program director identifies for the overall delivery of the didactic component of the program.
There you go. Asked and answered. Thank you for adding that, Pat. I just removed your permission to talk. If you have another question, please raise your hand. When will the new 5-year interim report template be available? You will need to, I apologize, since I work primarily with DCLS programs, there is no 5-year interim report. So that I don't have that information at the tip of my fingers. I would contact your respective program service person. They'll be able to answer that. I use a large hospital for clinicals. They will send the student to 3 different clinics. Do I need to include lab managers from the clinical site as clinical liaisons? I believe we kind of let you choose who your clinical liaison is. Obviously, you'll probably want to do that in collaboration with your clinical site, but that's not a specific requirement from NAACLS, and we don't necessarily require that they are the lab managers. We just ask that there is a person identified as a clinical liaison and that their information is there. And then obviously you will need to provide those other requirements that we have, like communication and some of those responsibility standards with that person. Any other questions? We only have about 5 minutes left in this session. These are generally the longer ones because of all the great answers everybody gives. Pat, go ahead.
That's another issue, I guess, that you just mentioned, clinical liaison. Some programs don't seem to understand they only need one and not one in every department of the lab. So I don't know how to make that more clear also. It's not a question, it's just a statement.
Yeah, clinical liaison is in our glossary as well. And so this might help. It says a member of the clinical faculty employed at the clinical site who coordinates the student's clinical experiences and serves as the primary contact for the student. And yes, you would identify who that would be at those particular locations to answer like Rita's question earlier. Mm-hmm.
Well, and I'll just add too, the DLPs and NAACLS staff are always available. If you're just, even if you read the definition, but you're just still not quite sure about something, reach out to, I mean, all of these people are excellent and very responsive, and we'll be able to guide you in the right direction.
Yeah, to kind of bring this full circle, that's the challenge that staff, our review committee members, and our board really faces, because we want to define these items, but we don't want to narrow your options when it comes to the people you use and how you use them and the methods you try to apply. So we have about 5 minutes left. Any other questions before we kind of wrap it up for the day? It does not appear so. So I'll start my thank yous. If something did just pop into your mind as soon as I started monologuing again, as Karen just said, please reach out to staff or DLPs whenever. We want to make sure that you have the support and the information you need to go through your accreditation process or just manage your day-to-day life as a program director. Thank you to Karen and Marisa registration for the next Dr. NAACLS should be available on the NAACLS news. I think that came out yesterday. So with nothing else, have a good afternoon, everybody.